my view is you have to have a very good safety net, because no matter how effective our systems are, and how much of an organizational culture we wrap around this, there are always going to be some individuals who experience a crisis, whether it's depression, it's a medical error that happened, that they are wrestling with the challenges of it, something in their personal life. We're always going to have that, and we must have a robust safety net for those experiencing that crisis, even as we try to say, let's create an environment where there are as few folks needing the safety net as possible. In the pandemic, and maybe the last introductory, when we think about our Stanford framework, we have that three-legged stool, if you will, trying to cultivate professional fulfillment, and we have to attend to personal resilience, yes, but also an optimal practice environment and an organizational culture that is characterized by leadership, flexibility, giving people voice, giving them input, community, self-compassion, that cultivates that. 6 months ago, a year ago, I think we were all in our focus on the efficiency of practice and the organizational culture domains, and less focused on the personal resilience domain, not because it's not important, but because we have very good data that healthcare workers are already resilient people. As we've moved into the pandemic and we've seen the high rates of depression, anxiety, PTSD, what we're dealing with now is different than just occupational burnout. We're dealing with mental health disorders and distress. And so I think that's been a big shift. And the question it has revealed is, how effective is your safety net? Is it robust enough? And I think for many organizations, they've had to strengthen that. And so it is a very different emphasis right now. I do think it's going to switch back. We'll go back. But right now, it's revealing how important that safety net is. And I think encouraging many of us to strengthen it relative to what our safety nets were before.